Good afternoon. Welcome to Cocktails and Conversations. This is your host, Doug Crow, and we're here having a cocktail, gin and tonic, or whatever you want in your drink, and have a nice conversation about my three favorite topics, which would be sex, politics, religion. Oh, four topics: sex, politics, religion, and business. Or five topics: sex, politics, religion, business, and mental health, perhaps. It's a good topic. People are going crazy with the COVID thingamajigger, so we're going to talk about that, but I'm going to have a guest on today, and she is, man, talk about a Cinderella story. I'll let her share more about her story, but I'm going to give you a little bio on our guest today. She is the owner and founder of Pennsylvania's premier therapy and assessment centers. It's a true statement. She's a licensed professional counselor with over a decade of experience in psychology field and has worked in research, university, and hospital settings before establishing her own company in 2017. She arrived at the I can't pronounce this. Don't say anything. Duquesne University School. I don't know. She worked at a really cool thing, University Alumni Advisory Board, and she leads a team of highly rated and specialized providers that are devoted to helping people heal and become happy again. She's been featured in major media outlets, including NBC, ABC, Fox, the CW, International Business Times, Scientific Journal, and hundreds of more media sources internationally. Now, this woman is rated a top 100 healthcare leader 2019 and an empowering woman in philanthropy 2018. She's been on the cover of Inspiring Lives magazine, the cover, Dispense magazine, that's a hint, Pittsburgh Avenue West, and Steal This magazine, STEEL. I'm going to ask you about that one. I don't know about that one. She's credited with international and #1 best-selling author on Amazon. The titles are called Depression to Joy and The Happy Entrepreneur. And she continues to spread her purpose of healing. She's recognized as a mental health care advocate and has successfully contributed to change policies and procedures regarding medical marijuana and online counseling. So without further ado, I'd like to introduce our guest today, Ms. Sara Makin. Ms. Sara, how are you today?
I'm doing well.
How's that for an intro? Even though I couldn't pronounce the one place, that's a pretty good intro. I was like, hey, you know, she's got some cred here, folks. I mean, really, she knows what she's doing, recognized by hundreds of places. Man, I'm looking at your in the news stream here, and it goes on. I can't even scroll that far. You're like all over the place.
Oh,
it's amazing.
Yeah. We've set up our counseling practices in a pretty unique way. We've had such wonderful outcomes, and that combined with the success for books that we've worked on together, it's been really
we'll
positive.
Talk about the book thing later. I want to talk more about you. I know you are very polite to appreciate what we did together as a team, but you've done a lot of the stuff by yourself. And you want to talk about mental health today, or sex, politics, religion, or business? What's your top 5 topic? What do you want to go with? Which one? Mental health? All right, I'll give you 5 minutes on that topic. Go ahead. We're good. Yeah. No, it's fine. It is important. We had another author on. The next place will be in the future. I recorded her call. And she did a book about depression. She was depressed as a teen, and she's an adult now, and talked about her 4-year journey. So it's kind of relevant to your demographic as well. But let me just start off with your background more detail, because I couldn't pronounce this university school.
Duquesne.
Huh?
Duquesne.
That's not Duquesne is Dukane. This is Duquesne. It's French or something.
Yeah. It's a pretty popular word in Pittsburgh because some Civil War stuff. I'm not entirely sure, to be honest.
You mean maybe the French Indian War? I'm not sure about the Civil War, but it looks.
That sounds like.
It could be. Am I a good guess? I don't know. You're smart. There's the bottom line, folks. She's educated and she's got practical experience. We'll talk about your journey, because I'm very familiar with your journey when we first talked about how you got started.
Oh, yeah. So I had this idea for a book and an idea for a business, and I just had this vision that I had no way or no kind of business knowledge on how to actually make that happen. And it's how I ended up getting connected with Doug, and he was really helpful for not only helping me launch Make Good Wellness and making that a success, but also with our books as well. So
I'm right here in the room. You don't have to say Doug. You can say you or Doug. I'm right here. Yeah.
No, it's you.
I'm just kidding. It's okay. You know what was fascinating, Sarah? When I share your story like weekly with prospects, people's like, does it actually work if I become an author? I'm like, if you work it, it does. If you do nothing, then it doesn't, right? But I don't know if you recall what you were like. What was it, 2 years ago, 3 years ago?
Oh, I do remember. I was so timid, so unsure of myself, just terrified.
You were so cute. May I ask, how old were you then? Like 24, 23 years old? How old were you? Come on.
20. I think it was 23.
23, right? So let me just frame it up from my perspective. Then I can go through when I talk about you. This is what I say. I'm like, yeah, I met this 23-year-old, slightly timid girl who was working at a clinic and wanted to go off on her own, and was insanely nervous about starting her own practice, but knew that she wanted to do a book. And we did her first book together, Depression to Joy, right? You wrote it. We just helped, obviously publish it and market it and whatnot. And within a couple of years, within 18 months, your business took off. With a couple of years, you got your second book out. You've got what, 2 offices now? Mm-hmm. And how many staff you have?
We have 9 clinical team members, a whole team of interns, medical billing, a practice management team, an intake department. You
built a real company. And plus, you've been on TV 20 times. She's lobbying the state legislator for medical cannabis use. You're like a rock star in Pennsylvania now, right?
Thanks.
I think so. But it started with I think I want to start my own business, but I'm scared. I got this rent due, blah, blah, blah. Right?
Yeah. Looking back, I'm like, oh my gosh, I was, but it was my first time, and I didn't really know what to expect, and I'm just really happy that I ended up going for it regardless, because I was very concerned. You know
what's funny, Sarah, is because one of your questions to me was, oh, Doug, I don't know if anyone's going to want to talk to me because I'm young. I don't have a lot of experience. And my response was, well, if you talk to any teenage girl going through their social and emotional trauma or stuff, they'd rather talk to you than some old 50-year-old crone. They want to talk to somebody closer to their own age.
Yeah.
And that's what you focused on initially with your clinic. Is that right? You focused on the youth?
Yeah. So initially we focused on really marketing towards teens, but because of the location of where the practice was,
right,
it was mostly professionals and, people in the 20s to about 40s. Right. So then whenever we changed the messaging, then we started to bring in a lot more people.
Right. Well, 20s is considered, in my opinion, it's still sub-youth market. I mean, 20-year-olds they're not. Come on.
Still young, yeah.
Their brains aren't fully developed till 25, allegedly, so, I don't know.
Oh, yeah.
All right. So anyway, my kudos to you because you're one of the poster childs I would have. Not child, that's not right. Poster adults I would have for people who start off with an idea for a book, a little bit nervous about it, and then do it twice, take the bull by the horns, and now have a hugely successful practice and influence in the areas you are passionate about. So now we can talk about mental health. Now that I've talked about how wonderful you are, I'm a huge fan. You notice that? So I got the big question I have about mental health. This we came up on my other show that we're going to air in the next few months. Is that no matter who you talk to, there's still a stigma. It's I can talk about cancer online to my friends or if it's a family member. Oh yeah, I got cancer. What do you do? As soon as you get mental health, it's geez, I don't know what to say or do or think about mental health. There's still this taboo about it. Why is that?
Well, that's a really great question. So for a really long time, there wasn't a lot of education shared with the masses about it. And, before there's this huge mentality of you just pull yourself up by your bootstraps and,
right.
Everyone has problems, you have problems, just get over it. But the truth of the matter is sometimes people genuinely have a chemical imbalance in their brain or have a genetic predisposition or environmentally in a place or in a situation where the likelihood of them experiencing a mental health diagnosis or illness goes up. And a lot of people are becoming a bit more aware about that now. I'm seeing there's a lot more ads on television for NAMI or in different other mental health groups. And people are starting to realize that not getting help is a lot more painful than it is to get help. Whenever you turn towards getting help, you're turning towards relief, and
Yeah.
it's really important. And the demand is only going to go up, and people's mental health is only going to get worse as a result of this.
Right.
We weren't designed to be in a quarantine type situation away from everyone, and it's, we're already feeling the effects now. We actually have a really lovely system for our electronic healthcare record. It's very popular. And they send out reports to the providers every now and again. They actually, in the report that recently went out, the behavioral healthcare usage was up 25%.
Wow.
Ever since April 1st, 2020 already. So it's just going to continue to go up.
Yeah, I read that letter that went to the president from at least 500 doctors about their individual cases and what they've seen out there in terms of the collateral damage or whatever of all this lockdown stuff, and it should not be minimized. It's like it's better to be locked down than to be than to catch a virus. Well, maybe it depends on who you are and your situation, I guess. But let me ask you a little bit deeper. Go down that rabbit hole a little bit deeper in terms of the social constructs. Why don't people feel as comfortable talking about mental health as they do about cardiac health? What's the differentiator there? Why is it awkward for so many people, in your opinion?
In my opinion, it is because that people tend to attribute their mental health as something that's a lot more deep and a lot more personal,
right?
When compared to having a toothache or, for instance, having a broken bone. And it's a lot more complicated whenever you are in the process of getting help for something mental versus something that's more physical. But the physical and the emotional can be linked. We've noticed, for instance, people with PTSD, if you're diagnosed with PTSD, there's a 25% increased likelihood of you also having a gastrointestinal issue. Many times people with severe emotional challenges also have some sort of GI issue. Right.
Yeah, I think I don't have a scientific way to say this, so it's going to come out clunky, but when you have a broken bone, or let's say you've got a heart condition, you can talk about that as like, genetics, diet, exercise, even whatever. But since we're talking about mental health, it goes back to our psyche, our personality, and either way we communicate with somebody. You can talk to somebody who's really depressed. It can sometimes make you sad, or somebody who's like schizophrenic or something. It makes you uncomfortable. But a broken bone doesn't affect me if you're talking with your arm in a sling. Doesn't affect me at all. There's some kind of empathetic connection with mental health and the way we deal with other people. Okay, that's my unscientific way to describe why there's this taboo, or Anyway, I just thought
people don't like to talk about things that may be true but make them feel uncomfortable. Right.
Yeah. Well, let's fix that, shall we?
Yes, definitely. The more that we talk about it in the open, the more the stigma is going to go away.
Right.
And if you look at it historically, the trajectory is that this is becoming something that's more and more normalized in the mainstream, and that eventually there's not going to be a stigma. It's just going to take some time. Right. Especially with younger generations, I see it now that we actually have, and we don't ask our clients to do this, just throwing this out there, but there's some that will tweet or make Instagram posts or Facebook posts about what they've learned in their session today with their therapist, and they'll tag us, and it's really lovely to see.
Nice.
Them seeing what they get out of it, and them spreading awareness about being in counseling.
Right.
So it's really lovely.
Good. That's good. It's like, hey, here's what I learned today from my therapist. I'm feeling better. It'd be like saying, hey, I just had a pap smear. I'm clear. Whatever. Well, one of your things you're championing, and one of the things that I don't know if we want to talk about our extra secret project that's coming out or not, but this show is called Cocktails and Conversations, and I told people I'm drinking gin and tonic, but I can't lie, it's not. It's soda water today. And you're not having
Yeah, I hate to disappoint everyone, but this is a tangerine vitamin drink.
No, we're not going to disappoint because I'm going to bring the next topic up right now, okay?
Okay.
Sarah and I are both like healthy people. We try to be healthy, so we're drinking this healthy drink. We're not drinking alcohol right now. But one of the things you lobby for, you're very passionate about, is what is it? Medical cannabis, right?
Yes. Yeah.
Yeah. So I'm not sure if, since we're not having cocktails, if you want to relax a little bit with your. It's not legal here. I'm joking, folks. This is not. I'm South Carolina. This is not even a. This is nothing. But I'm just saying, if it was, that we could talk about the medical use for cannabis in our country. So you were lobbying like the state legislator for this, right? You told me.
Yeah, so I'm really passionate about causes that promote natural health and preventative health.
Right.
And in the state of Pennsylvania, we have a really fantastic medical marijuana program.
Nice.
The way it's basically set up is that there's currently 23 qualifying conditions, and you have to have the qualifying condition in order to get access.
Just one out of 23, right?
Yes. You have to have the condition, and then you have to have the paperwork supporting it.
Do you happen to have those memorized, those 23 conditions, or at least a dozen of them?
Memorized, but I'm more than happy to share the mental health and the addiction ones. I do have those.
Go for it. Let's hear it.
So in the state of Pennsylvania, it is opiate use disorder, any anxiety condition, PTSD or post-traumatic stress disorder, and autism. All the other ones are things that we can't diagnose.
Like glaucoma and things like that, right? Whatever they are.
Yeah. Like that.
Okay.
Pain, I believe cancer as well.
Yeah.
And so, we were treating a lot of patients here with PTSD, and we started noticing that the patients that we had that had PTSD and anxiety were really benefiting from it.
Nice.
And so started to look more into the research and see anxiety would be really beneficial to add on as a qualifying condition too. So I ended up connecting with a couple of other people that are also very passionate about medical marijuana that are also in this industry, and we ended up connecting and putting together some documentation, sending it to the Department of Health, and they ended up reviewing it. And before we knew it, anxiety was added on. And actually, the way that we found out is that they went to press before they told anyone. So we found out when everyone else found out. But it was really exciting, and we had a couple of weeks to prepare for it. But there's a huge flux in patients once anxiety was added on as well.
I have anxiety. Please give me a prescription. So did you actually go to like the state legislator yourself, or just do the paper? What did you actually do to get this thing going?
That's a great question. So we put together the paperwork, but I also met with some legislators as well and explained to them all the research and why this is going to be helpful, not only for patients, but also for our economy as well. So.
That's right. Did you explain to them that, if they don't pass it, it could make more anxiety and they really should get going on, or what? Did you? Not just a joke. What up?
I didn't hear the last part that you
No, I just said in terms of, I would, tell the guys, I get anxious every time I go to, any lawyer or congressman. So your anxiety is going to increase anyway. So, you might want to pass this. and they did apparently, right? It's a medical state, but not recreational state yet. Not
recreational yet. Pennsylvania's program is really very focused on having it to be more medicinal, which is why you actually legally can't even smoke the cannabis here. You have to technically vape it or vaporize it.
Okay.
So I'm not sure when they're going to be ready to go full.
Okay. You're not feeling anxious now, are you? You okay?
Right now, I feel great right now.
Okay, good. Me too. I'm fine. Yeah, this is just an old thing.
Yeah, I actually tried some new CBD today, and
only
about an hour ago. It was really lovely.
Okay. Speaking of CBD, when I was, my dad has Parkinson's, right? So he was shaking, and not even his spoon was like, it was getting point where almost to point someone had to feed him. He was like shaking his hand. I got him some really good CBD oil when I was in Nevada at a dispensary. Two drops in his coffee, shakes are gone. Like within a couple of days, he doesn't shake anymore. Yeah.
Amazing.
It's kind of powerful stuff. So it's not snake oil, but it sure does sound like it sometimes when people talk about it. So
Yeah, and especially if you haven't experienced it yourself, or if you don't know anyone who's experienced the benefits of it, it's understandable why someone would be skeptical or, unsure if it's truly something that can be effective. But what I've noticed is, at least from the mental health standpoint, that it can be a really wonderful thing to add into your wellness regimen if you have high levels of stress or anxiety, if you're easily triggered. It kind of helps people to relax a bit more. Or if you have a difficult time with sleeping and sleep medications aren't working, or melatonin is not working.
Yeah, I'm not a melatonin fan. I'm having real trouble sleeping a while ago. It's better now, but the CBD didn't work much on me personally. I tried it for joint pain, but maybe you give me a better prescription there. I know you can't prescribe it. You can.
Also, the dosing of it is quite important as well.
Oh.
So the way that you dose it and the way that you ingest it is also important. So sometimes microdosing will work better if someone wants to use CBD to fall asleep. So basically you split the dosage up into 3 or 4 different parts, and then space it out within time intervals, like 20 or 30 or even 40 minutes apart. To help you fall and stay asleep. So you might want to try that. And see. All right.
Now I've read enough about this to be dangerous. There's 1,000 different versions of this out there, and one of the ones somebody told me about has some kind of nanoparticles, had a higher absorption rate, because a lot of times what we ingest, most of it gets peed away. We don't really absorb a lot of it. Do you have any opinion on the absorption rates for different CBD products or in general?
Yeah, that's a really great question. So a pharmacist, a pharmacist that specializes in cannabis would definitely be able to answer that question much better than I would be able to.
She's a professional, folks. I wasn't trying to trap you on purpose to make a medical opinion. I just was curious from a standpoint. All right, cool. So all right. Well, I'll have to talk to someone.
Good.
No, it's okay.
Yeah.
All right. So give me without, obviously we can't name names, but I'd like to hear a success story about somebody you've helped out that really touches your heart in terms of the mental health issue.
Oh, absolutely.
Yeah.
There's so many people.
I know you've got hundreds, but give me the first one that comes to mind is usually the best. So first one that comes to mind.
Okay. So there was one client that we had that was having a lot of kind of relationship distress. Business was going well, but he wasn't very passionate about it anymore. Was very torn between, kind of going out and cheating on his wife and getting another condo and just doing whatever he wanted to do.
Yeah.
And that's whenever he started to see me. And so
now you're engaged.
Yeah, and now we're.
Just kidding. I'm just kidding. I have fun. I know you're engaged, but not to a client. I'm joking. Okay.
So midlife crisis.
Right. Of course. Yeah.
And so then we started to meet and started to talk about what was actually going on in the marriage, what was actually going on with his mental health, and he was extremely anxious. And so we started to have a lot more of. It was called cognitive behavioral therapy. So basically, I helped him to see what kind of thoughts that he had and helped to adjust the way that he thinks and to challenge himself when he started to think in a logical kind of way.
Sure.
He started to feel a lot less anxious and actually became a part of the medical marijuana program and found that to be a huge benefit. The combination of addressing all these things that were really stressing him out, that were holding him back, helped to relax him, combined with medical cannabis and the treatment. He actually was able to start to eventually wean off his medication, and his relationship got a bit better, got much better, and his mental health definitely improved a lot. And
now him and his wife are both stoners. I love it. What a love story that is. I'm so bad. I can't not make jokes about this stuff. Is that okay? I know maybe you're not allowed to in your practice, but I thought it was good. So that's good. So how long did it take him to go from going down this dark path of making all these mistakes to okay, I've gone through this combination of cannabis, cognitive therapy, things you're doing there, to where he's like, I'm okay now. I'm not gonna jump off a cliff.
It's a great question. So for him, and for everyone, it's very different.
Oh yeah.
For him, this was his first time in counseling, and he had a lot of things to address, and a lot of trauma as well. Mm-hmm. So it took about a year.
Okay. But still, listen, there's these paths, sometimes there's no going back once you go down them, and whatever it takes, there's no other way to put it. You have probably saved his life, or you saved a better direction of his life that he went down. So it's very noble.
Thank you. Yeah, it was really lovely getting to see the change. It's very rewarding. That's
right.
One of the things that our team definitely talks about is how rewarding it is to see people's lives change and to see people truly heal in a very deep way.
Well, and that's one of the key things you brought up years ago when we first met. You used the word outcome-based practice like over and over again, everything you said.
Yes.
And you and I are both on the same page in this, but it bears repeating to everybody out there who may or be watching this that, this is not very common. I have seen a lot of people talk in medical profession in general. I'm not going to name names or anything, but like, okay, take this med, do this, do you feel better, blah, blah, blah. It's like, yeah, here's a drug, go fix it, as opposed to focusing on the patient, not the symptom, right? So you focus on the patient and their desired outcome, obviously a positive one. And, there's there's rarely one thing that fixes something. It's usually, like you said, there's a combination of factors here. And you only get to know that by diagnosing the person, not the disease. Am I way off here, or is that kind of the way you look at things?
That's a really great observation. That is very true. Seeing what's actually going on with the person really can lead you to help them in a much more deep kind of way versus if you just look at this is the diagnosis and let's implement these 3 steps that we tell everyone to do to feel better. The cookie cutter model for treatment, it doesn't work very well the majority of the time, although it does work for some people. Much better outcomes whenever you individualize the treatment and really get to know the person really well and see what would benefit them the most, and also to get them to participate in it and to see what they even want to do, rather than you telling them, okay, you have to stop drinking caffeine today, or you have to meditate twice a day. Like, people don't like to be told what to do, especially adults.
Yeah.
Well,
especially kids, actually. Either one. Yeah. So here's the question for you. Everyone's different, right? And there's dozens and dozens of different things we can do for people. How do you determine what and when? I mean, say, like, take example, your patient that was the midlife crisis guy. You had a bunch of things you did for him. How did you determine what to do and when? There's a formula, or is it like just experience?
A lot of it is experience, and it's years and years of experience of seeing what can the person benefit from immediately and right now, what's most relevant to them, and then you go from there. Okay. So first, he was most concerned about I just need to change everything in my life and sell my house and get a divorce and do all this stuff. So that's where he was at that point when we first met. So that is what we addressed at that point. Yeah. When that kind of crisis situation eased down, calmed down after we talked about it, and he came to his own conclusions about what was best for him, then we were able to address a lot of the anxiety and the trauma and the other things that were really going on under the surface that were affecting his behaviors, not only in business, but with his relationships overall.
All right. That's experience is the right answer for that, I'm sure, because I wouldn't, I don't know what but it just seems like there's so many variables there. And I got a question about cognitive therapy, too, if you're ready for a good zinger. All right. So we know that the subconscious brain runs the show.
Yeah.
Right? 97% of all of our functions happen because of our subconscious brain, and our croc brain, our primitive brain, usually says fight or flight. It's just simple things. And this prefrontal cortex with all this, advanced thinking and reason and emotions, all that stuff, that's the one we can actually more or less control. But it seems to me, and I've talked to a couple of neuroscientists about this, that our behaviors are deeply rooted in our primitive brain, and we're talking to it from the, prefrontal cortex or the advanced mammalian brain port, and those two don't always talk to each other. Do you ever go into the basic things, the primitive brain functions to get people to change their behaviors?
That's a really great question.
Yeah, thanks.
So when someone is in an alpha brainwave state, that they're in a state then where their blood rate is their blood pressure is reduced, the rest of the heart rate goes down, the left and the right hemispheres of the brain are synchronized, and they're more open to suggestion, meaning that they're more open to accepting and believing and changing compared to what they normally are in a regular conscious kind of state. So there's different ways of getting into that type of state. But typically in session, the easiest way of getting into that relaxed state is by doing deep breathing, which the therapist can guide them through to get to there. And then once they're a lot more relaxed and more suggestible and more open, then it can be quite helpful having things such as cognitive behavioral therapy, because cognitive behavioral therapy in of itself is extremely effective and a lot of science supporting the efficacy of it, especially for things like anxiety and depression and addiction.
Okay. So the alpha state, I'm curious about that one. So it's not hypnosis, but it's just a relaxed state?
Relaxed state, yes. Yeah. You're still completely conscious. It's just, I don't know if you've ever noticed the way that you feel right after you take a lot of deep breaths. That's early stages of the alpha brainwave state. You can actually get into that brainwave state too by listening to either Baroque classical music or binaural beats as well. It helps to promote that brainwave state to happen. Yeah. And you can be a lot more focused too. So there's some, people that will play Baroque classical music while they are working or while they are reading, and they tend to remember a lot more of the information that they're exposed to, and they tend to be more focused as well.
Oh, I guess so. My Alice Cooper collection isn't going to work then. All right, we'll go back to Bach. All right, got it.
Maybe not trying to be productive.
Well, it was last day of school for my daughter, so I played the School's Out for Summer song. I thought it was kind of fun.
Oh, it's lovely.
Yeah. She's a teacher now. All right, that's very interesting. So the binaural beats, I actually know something about. One of my other author clients is putting that into his book program for weight loss, putting binaural beats in there to help a person
that's amazing.
retrain their habits for healthy eating, because there's a lot of people, including me, who have a little bit of emotional eating. When I'm bored or anxious, I might, grab an extra something, and it's probably not a good deal eating when you're not hungry. So his binaural beat program I just started, and it's very interesting because I don't really feel any different, but I see a difference. So, yeah.
That's amazing. And the emotional eating aspect is so challenging to address because everyone has to eat.
Yeah.
And then the feeling of, and this is why we actually have a nutritionist on our team too, there's so much about food and water that really can affect your emotional state too.
Yeah.
So for instance, if you are chronically dehydrated, you might feel like you're hungry 24/7, but that feeling of hunger is actually the feeling of thirst.
Yeah.
It's very similar. So many times when people overeat or are eating emotionally or eating out of boredom, they're actually thirsty or they're just bored. So if you go and have a huge glass of water and wait 15 or 20 minutes, the level of you actually wanting to eat goes down substantially.
Okay. Right.
So that might be something you may want to try out to see.
I do. I got a big jug of water. I drink. I think I drink my 7 to 8 glasses a day. I'll start counting and see. But you said, sometimes food makes you feel better. I mean, I drink a glass of water, it's fine, but a bowl of ice cream makes me feel a lot better, at least initially.
Yeah. Immediately afterwards, because you have all the feel-good hormones and chemicals going on, and then 10, 20 minutes later,
I just want more. That ice cream is good, but now it's gone. So what are you gonna do, Crow? Yeah. Okay. All right. So do you want to talk about your next book, or you want to just focus on what you got now with mental health? What do you want to do? It's up to you.
We can definitely talk about the next book.
It's up to you. Don't have to mention any partnerships or names.
It's all a secret.
It's all a secret. There's a big book coming out very soon. I think you should keep it a secret, but let's understand. It's up to you. It's up to you. You're the author.
Keep it a secret.
All right.
Like a big surprise.
But so you're in the Pennsylvania area, right? Pittsburgh.
Yeah.
All right. Now you're doing also telemedicine now, obviously, with all this coronavirus stuff. Do you see patients outside of your area at all, or are you still focusing in your metro area?
So that's a great question. So right now we're able to see any client in the U.S. because they have kind of laxed licensure portability for the time being.
Right.
We do see mostly Pennsylvania residents, but we can really see anyone, and we're in network with most of the major insurance companies too, and a lot of them are allowing us to waive the copay. So it's $0 per session, which is really lovely.
Well, with that in mind, Sarah, it's time for a shameless plug.
Yes.
So, Makin Wellness, makinwellness.com, great site, great staff, warm people. What would you like to tell somebody who's having some trauma or anxiety nowadays? How can you help them out?
It's a great question. So anyone who's going through a hard time, I would highly suggest for them to give us a call. We can get you scheduled in very quickly with a highly rated and specialized provider that really does care. Our entire team, all of our life's missions are basically the same, and we're all about helping people heal and be happy again. And we're so excited to be able to help anyone who is ready for it and whoever is ready to make a change.
Outstanding. And just a disclaimer here, you can't actually prescribe medical marijuana. Has that changed? Do you have anybody on staff now that can do that, or are you still the...
Yeah, that's a wonderful question, Doug. So we are able to evaluate and to diagnose for mental health addiction conditions. However, we do not certify. You actually have to see a medical doctor who is licensed to do that, which we know a lot of wonderful medical marijuana physicians and centers that we more than happy to refer you to.
Yeah.
People will come to see us to get treatment and to get the evaluation done, and then they would have to see the doctor once a year.
Right. Yeah, I met a wonderful doctor on Venice Beach in California who talked to me for I think it was close to 30 seconds about my anxiety before I got my prescription. It was an amazing thing in California there.
Oh, yeah. Every state...
Sarah making a joke. It's like, California, they are all recreational now, but at the time it was only medical, and they had these guys on the beach like, yeah, I'm a doctor. He wrote a script after talking 30 seconds. You feeling a little anxious? Oh, okay, here you go. It was just funny.
Wow. Yeah. It's everywhere handles it definitely differently.
Yeah, I know. All right, so yeah, Makin Wellness, makinwellness.com. Go there. Is there a number they can call just in case you're not going to go online? Just give them a number.
Yes, they can give us a phone call at 412-532-1249.
Outstanding.
And it's typically easier if you call and have your insurance card handy so we can talk to your insurance, get you scheduled in, send over all the paperwork, which we do everything electronically, so it's very, very easy, seamless process. And
outstanding. And folks, just understand this. There's a lot of people that do, therapy, wellness, blah, blah, blah. But Sarah and her team, I can tell you firsthand knowledge, they've got the holistic thing here. It's not just your condition. It's you as a human being. And they take the time to make sure that you're on the right path and the right track to get your desired outcome. So go to makinwellness.com, and then don't forget, if you want a couple books on this topic, you're all over Amazon with Depression to Joy, and the other one, Entrepreneur Story. What's that one called? The second one?
Happy Entrepreneur.
The Happy Entrepreneur. Well, you're obviously happy, and you're not depressed. You're in joy, so you know how to get there. And it was great having you on the show today. Have to come back when your third book is ready. I want to hear all about that. So.
It'll be wonderful. I'm so excited for it already.
Outstanding. All right. Sarah, thank you so much today. This is Doug Crow with Cocktails and Conversations with the lovely Sara Makin. And we are out. Thank you so much for your time. Talk to you later.
you.
You bet.
Yeah.
Bye.